Today I want to talk about something different, but kind of trendy. I want to talk about psychedelic psychopharmacology, which means taking hallucinogens like LSD, ecstasy, and another one called ketamine to produce psychotherapeutic results. In other words, helping people with depression. This is going to be a good one. Check it out. Hi, I'm Brett, your favorite shrink, and welcome back to My 5 Minds. This is where we're learning about systems psychology. That's systems with a P. And in systems, there's certain premises. Today, we're going to look at the first, what we call a consideration, the first consideration in systems, which is you are not broken and you are unbreakable. Some of the best evidence I've seen for this comes out of the use of hallucinogens in a psychotherapeutic environment. So specifically, I want to tell you a story about Mike. Now, Mike was a patient of mine who had probably the most severe depression you'd ever seen. He was on a death path. He was in self-destruction mode. He was so depressed because he had just probably months before he came into psychotherapy, he started to recall and remember traumatic abuse as a kid. He remembers being a little boy and his older brother performing sex acts with him, and then he, being a little kid, started performing sex acts on his siblings and other other neighbors, and the information that was coming in his brain was overwhelming. He was just devastated with shame. Kind of, can you relate? Wouldn't you be? But he shouldn't have been, because he was just a little kid, 5, 6 years old. But as he started to recall this information, the information was just too much for him to absorb, and really even too much for him to deal with. And so he started down this path of depression. And the depression was his penance. It was his punishment for what a terrible, awful, no good, rotten person he was, because he had done these things to his own family and other people. And so, he wasn't worthy to live. And he wasn't really able to muster the courage to kill himself. So his plan was to destroy everything in his life, to make himself so completely miserable that he would either A, suffer forever, or B, he'd find the ability to finally take his life, because this was just so awful and terrible. So he ended up losing his job because he couldn't get out of bed, couldn't show up to work. Even when he was at work, he was depressed. He was losing his marriage because he was doing things that would intentionally hurt her. He would go to strip clubs. He was, not willing to stay faithful to her. He didn't really have any affairs, but he let himself act out sexually because, again, he's seeing himself as sexually defective, right? So he's going on this path and just destroying himself. Even psychotherapy, he's not going to show up. He doesn't want to show up. He doesn't want to change because he doesn't deserve it. He's not worthy. So the best I can do with this guy is convince him to go see a friend of mine, Dr. Tom Drashel. Now, I love Dr. Drashel because Dr. Drashel and I have worked together both at an outpatient clinic I was the director of, and he was my medical director, and also in his own clinic doing psychedelic psychotherapy groups. Right? Weird? But what they are is basically he would induce a kind of a hallucinogenic state through using ketamine, orally or intravenously. And then the patients would go into these altered states, and we would work with them therapeutically. So this particular patient, I convinced him, come on, dude, you gotta go, you gotta see this guy. So he goes in to see him, and the way ketamine works is really fascinating because the doctor gives him a shot, and the ketamine itself only works for 45 minutes. It's kind of like amazing. You give them a shot, patient goes under, they see things, they hear things, they experience things, and then it's almost like on the minute, 45 minutes, they come out, they wake up. And then they stay in the clinic for a little while to make sure that they're oriented and we have somebody else drive them. But it doesn't last that long. And the treatments, here's the weird part. The treatments are six treatments, that's it. You don't take ketamine or any other hallucinogen for the rest of your life, right? Would that be a problem? Yes. But you do it a couple times with the doctor's supervision. And he did it. And after 2 sessions, he comes back into therapy and he's like, I feel different. And all of a sudden now in his head, there's a voice. And the voice is, it's going to be okay. His life is still a disaster. I mean, he's done everything to destroy it, and it's still all in play. He's not working. His wife's PO'd at him and scared of him. And, he's kind of just in this same funky place. But he's different. And what is different about him? What changed? Well, medicine, the medical model, would say that his brain chemistry changed. No. There's zero evidence of that in terms of being able to take somebody's blood samples and then measure it before and measure it after and see any kind of measurable difference. There's no evidence of that at all. And it doesn't even make sense. The medicine stops affecting your system in 45 minutes. It is not like in your system for the rest of your life. So that can't be it. And you're only doing 6 treatments, so how is that going to create permanent biological changes? It doesn't. But what it does do is it works on that first consideration that we're talking about in systems. It changes you. It reorients you to the truth. And the truth about you and the truth about me is you are unbroken. I'm unbroken. We may have problems. Yes, we may have depression or anxiety or whatever's going on in our lives. But that's not who we are. Isn't that amazing? Who I am is unbroken. Now that unbroken nature is my consciousness. And that's what any of the hallucinogenic medications do. They put you in this altered state and they give you a taste of your true nature. They put you into a state of consciousness. It's not a state that you've induced yourself, it's a state that chemicals have induced, but it makes you aware that who you are is this pure, unbroken consciousness. And then all of a sudden you see your depression from a third-person point of view. You're able to observe your depression. And when you can see your depression, you can realize that you are not your depression. And that is the first key to system psychology. That's what's happening with these guys. That's what's happening with my patient, is he's able to see his depression and not be his depression. Well, I think he did 3 treatments, 4 treatments, didn't even do the full 6 treatments. But already he started to feel better, and already that gave him enough momentum to begin to work in therapy, to begin to work on himself, his relationships. He was able to get back to work. He was able to begin to function again as a human being. And the most important part was we were able to begin to work on those issues, to work on the depression, because that didn't go away. The ketamine doesn't magically take away your depression, it gives you perspective. And with that new perspective that I am not my depression, then we were able to work on the depression. You can't change your depression if it is who you are. You have to be able to see your depression or your anxiety or any other mental illness, see it without being it. And that's what he was able to do. Now, homework for you. I want you to go out this week and I want you to try a new consideration for yourself. I want you to try being conscious of your depression. I want you to put yourself in a third person point of view and to be able to look at what you're feeling, but not be what you're feeling. To see the truth about you is that you are consciousness. The truth about your body is it may be depressed, it may be anxious, it may be broken. That's different. Your body being broken is different than you being broken. So that's what I want you to work on this week as your homework. Practice being conscious. And even practice being conscious of the things in your life that aren't working. But see them from a new point of view. Again, thanks for watching. If you like this video, like the video. If you want to learn more about systems with AP, I want you to subscribe. Again, I'm Brett, your favorite shrink, and you're watching My 5 Minds. Talk to you soon. Take care.